Hello.
Hello. My name is Allie, and I'm going to be your nurse today.
Hi, it's nice to meet you.
Yeah, nice to meet you too. Is it okay that we ask some questions?
Absolutely.
Okay. So, what's your name?
My name is Hannah Helton.
And what is your phone number?
513-453-2779.
And what is your address?
6570 Pressed Circle, Middletown, Ohio. And the zip code is 45042. 42.
And when is your date of birth?
March 18th of 1998.
And where were you born?
Middletown, Ohio.
And how old are you?
I'm 19.
And you're female. And what's your marital status?
Single.
And what is your occupation?
I am a student.
And what would you classify, like, your ethnic group?
Caucasian.
And who's your employer?
Anderson University.
Okay. And why are you seeking care today?
Just a general checkup, like a physical kind of thing.
And do you have any present health or history of illness? Okay. Now I'm going to ask you some questions about your health.
Okay.
So, how would you describe your like overall general health?
I would consider myself to be pretty healthy.
Did you have any childhood illnesses?
No, I was prone to strep throat quite a bit, but I got my tonsils out, so that helped with that. I had some ear infections a lot too. Usually related to the strep throat. So.
And then, like, would you go to a doctor for that and get medicine?
I had an ear, nose, and throat specialist.
Did you have any accidents or injuries?
When I was 11, I broke my right arm and right thumb. When I was 12, I broke my left wrist and crumbled my growth plate.
Anything else?
Not that I can think of.
Okay. And do you have any, like, serious or chronic illnesses?
I have polycystic ovarian syndrome.
And when were you diagnosed?
When I was 16.
Did you take medicine for that?
I'm on birth control for that.
And have you ever had any hospitalizations?
I was hospitalized when I was 3 because I stopped breathing. I was hospitalized when I was 15 for PCOS, and again when I was 17 for PCOS, and for my appendectomy.
And where were you hospitalized for those?
When I was 3, I'm not sure. It was somewhere in Pennsylvania. When I was 15 and 17, it was Cincinnati Children's.
Okay.
And my appendectomy was community hospital here in Anderson.
Okay. And have you had any surgeries?
Yes, I have had an appendectomy, a tonsillectomy, an adenoidectomy, tubes in my ears, and my wisdom teeth.
Do you know the age you had your appendectomy?
18. I had tubes at 3 and 5. My tonsils at 9. my adenoids at 4. And my wisdom teeth at 17.
Anything else?
I don't think so.
Have you had any pregnancies?
Nope.
Okay. Have you had any abortions? Do you have any children?
Nope. Not biological, at least.
Are you up to date on your shots?
Yes, I am. I had my flu shot and my tetanus shot in October.
Of last year?
2017, yep.
Okay. And when was your last examination, the last time you went to the doctor?
January of 2018.
Are you allergic to anything?
I have seasonal allergies, and I'm very allergic to cats.
And, how do you react when you're around those?
My seasonal allergies is just like a runny nose, but when I'm around cats, my throat closes up and my eyes swell shut.
Do you have an EpiPen for that?
No. I usually just try to get out of the area and take a Benadryl.
Okay, I take Benadryl. Okay. And what are your current medications?
I am on triprevifim. That is TRI-PREVIFEM. That's a birth control. I am on Zantac. And it is 75 milligrams. And I am on escitalopram, ESCITALOPRAM, and that is 10 milligrams. And I take Zyrtec whenever I need it.
Do you have any heart disease?
Nope.
Any blood pressure?
I don't have high blood pressure, but I do have low blood pressure.
Okay. Do you take medicine for that?
No. I just have to watch it. It doesn't get, too low.
Okay. Have you ever had a stroke? You already said you have allergies. Do you have asthma?
Nope.
So now I'm going to ask you some questions about your family.
Okay.
Does anyone have diabetes?
My maternal and paternal grandparents. Grandmas.
Any blood disorders?
Anemia, me, and both my grandmas. I don't know if do you need to know that I have that too.
Any history of breast or ovarian cancer?
My maternal grandma and my
mom. Any other kind of cancer?
Pancreatic, lung, and some other kind that I can't remember right now.
It's okay. Does anyone have sickle cell? Arthritis?
My paternal grandfather died of rheumatoid arthritis.
Any history of alcoholism?
My great-grandfather on my dad's side and my grandfather.
On your dad's side as well? Any history of mental illness?
My paternal grandmother had a nervous breakdown. My paternal great-grandmother had a nervous breakdown. And every great-great-grandmother before her as well. My dad has depression and anxiety, and so do I.
Okay. Any history of suicide?
Nope.
Or seizure disorder?
Nope.
Kidney disease?
No.
And tuberculosis?
No.
Okay. Now I'm going to ask you some questions about like your health in general, like all your systems. Okay. So for your general overall health state, have you noticed like any weight gain or loss, like abnormal?
Nope.
Or anything by like your diet?
Nope.
Have you like had any fatigue recently?
Yes.
Yeah. Is that how like just due to stress or just like?
Yeah, and my anemia too.
Okay. Any weakness?
No.
Fever or chills?
Mm-hmm.
Do you get like sweats or night sweats? So your skin. Do you have a history of like eczema or hives?
Eczema, especially on my hands.
Have you noticed any like pigment or color change?
No.
Or any moles?
No.
Excessive like dryness or bruising?
No, just dryness related to the weather. Yeah.
Okay. Any like bruising or rashes, lesions?
No.
Have you noticed any recent like hair loss?
No.
Or like a change in the texture? Is it like more oily? No. How about your nails? Have you noticed them like if they're more brittle or more stronger? No. Anything in the shape or the color? Do you? How much sun exposure would you say you get?
Like a normal amount.
Okay.
When I'm out in the sun for long periods of time, I use sunscreen.
Okay, you use something good. What are like? Do you have any methods for like self care or like your skin or nails?
I wash my face with normal acne stuff, and I use shampoo and conditioner and soap.
So for your head, do you have like unusually frequent headaches?
Migraines.
Okay.
And I take Excedrin, migraine, whatever, when I...
Have you had any head injuries? Have you ever had a concussion?
Nope.
Okay. Do you experience dizziness or vertigo? No. Okay. How about your eyes? Do you have any difficulty with your vision?
No, I wear contacts or glasses.
Okay.
I have the day and night ones, so I can leave my contacts in for up to a month at a time. And my last vision check was in October of 2017.
Did they like find anything out of the ordinary?
Mm-mm. I do have a freckle on my eye that they thought was a tumor, but it's just a freckle. It's extra pigment. So.
Okay. Do you have like double vision or anything?
Nope.
What about glaucoma or cataracts?
We have a history of cataracts in our family.
Okay.
My mom had them, but hers was related to an injury, so hers was different, but both of my grandmothers had cataracts.
So both your grandmothers.
Mm-hmm.
Okay. Contacts. Yeah. And you don't have any loss of vision. Do you have an astigmatism at all?
Mm-hmm. In both eyes.
Okay. And so you have like special contacts for that. Okay.
Yep.
And what about your ears? Do you have like any earaches or infections?
Not anymore. I did when I was little.
Okay. Do you have any discharge?
Nope.
Any tinnitus or vertigo?
No.
Do you use hearing aids?
Nope.
How do you clean your ears?
When I was younger, with my ear person, they told me to roll the end of the tissue up and use that instead of Q-tips.
Do you still do that?
Mm-hmm. I grab a Q-tip in a time of need, but I try to do the tissue just because I have ear issues.
And how often do you clean your ears?
When I get out of the shower.
Okay.
So every day.
Okay. And so we're gonna move on to your nose.
Okay.
Have you noticed discharge or any out of its norm?
Mm-hmm.
No. Okay. Do you have any frequent or severe colds? Mm-hmm. Do you have any sinus pain?
Nope.
Nasal obstructions? So anything like clogging?
Nope.
No. Do you have any nosebleeds?
I don't anymore, but I had to have my nose cauterized when I was in high school.
Do you said you have allergies?
Mm-hmm.
Do you have hay fever?
Nope.
Have you noticed a change with your sense of smell?
Nope.
Okay. So your throat and your mouth. Do you have any mouth pain?
Nope.
Or frequent sore throat, bleeding gums, toothache?
No.
Do you have any lesions or cold sores in your mouth?
No.
Have you have noticed a hoarseness or a change in your voice?
No.
Have you had a tonsillectomy?
I have.
Do you remember how old you were with that? It's okay.
I think I said 11.
Okay.
10 or 11 or something
that's
like
right.
that.
Yeah. And then have you noticed an altered taste?
Mm-hmm.
Okay. How do you brush your teeth?
Mm-hmm. Twice a day.
Twice a day? Okay. Do you floss too?
Yes, because I have those permanent retainers
Okay.
in my mouth, and so I have to use that weird thingy. Those.
Yeah, the little
Yeah.
stick thread.
Yes.
Yeah. And you don't have dentures or a bridge. And when was your last dental checkup?
December of 2017.
Okay. So for your neck,
Okay.
have you noticed any pain or lumps?
Mm-hmm.
No. Have you noticed any swelling or enlarged nodes? And for your breast,
Okay.
have you noticed any pain or lumps?
Mm-hmm.
Or nipple discharge?
Nope.
Okay. Or rash?
No.
Do you have a history of breast disease?
I do not, but my mom had breast cancer, but she was not a carrier. She got it tested.
Okay. Have you had any surgery?
Mm-hmm.
Okay. Do you perform self-breast examinations?
Mm-hmm. Probably every other month. And then when I go to the gynecologist, he also does one just because of my family history.
Yeah. How often do you go?
Once a year.
Have you ever had a mammogram?
No.
Okay.
I had to start at 25.
Okay. Okay. And so moving on to your respiratory system.
Okay.
Do you have a history of lung disease?
Mm-hmm.
Like asthma or bronchitis?
No.
Okay. And have you ever had pneumonia?
Nope.
Do you have chest pain with breathing
No.
or any wheezing or shortness of breath?
No.
How much activity produces your shortness of breath?
I would say a
a
normal
amount?
Yeah.
Okay, so nothing too straining. If you cough, do you have a sputum or a mucus? No.
Nope.
Are you exposed to any pollution or toxins?
No.
Okay. Have you ever had a chest X-ray?
No, I have not needed one.
So your cardiovascular, so your heart. Do you have any pain around your heart or in your chest?
No.
Have you ever felt any abnormal heartbeats?
Mm-mm.
Have you noticed any cyanosis, so if you turn blue or anything? Okay. When you stand up and sit down and or sit down and then stand up, do you noticed any weird feelings or
No.
Okay. Even when you lay down?
Yeah, no.
Okay. Do you wake up regularly to go to the bathroom at night? Or Do you like ever wake up to that?
Not really.
No. Okay.
Unless I've had a lot to drink.
Okay. Do you have a history of a heart murmur?
I do not, but my mom does.
Okay. And you said you have low blood pressure.
I have low blood pressure, but everyone in my most people have high blood pressure in my family.
Okay.
My brother and I both have low though.
Okay. Do you have a history of coronary artery disease? Or anemia?
Some anemia.
Have you ever had an ECG
Mm-mm.
or any other like heart test, like a stress test or anything? No. So now for your veins,
Okay.
have you noticed any like coldness, or any like numbness or tingling in your feet or your hands?
No, just when my feet fall asleep because I cross them too long.
Yeah, so you cross your legs when you sleep or when you sit.
Mm-hmm.
If you do since you do cross your legs, you can sit with them like uncrossed. That will prevent them from falling asleep.
Okay.
And you can also wear some like support hose socks too to help with the circulation. Do you have varicose veins?
I have spider veins, but my mom and her dad both had varicose veins.
Yeah, and wearing those socks will help with those too.
Okay.
So, have you noticed any like gout or anything like that?
Mm-hmm.
No. Okay. Does your work involve long-term sitting or standing?
Not particularly. It just kind of depends on the day.
Yeah. Okay.
Some days are longer than others for sure.
Yeah. And so now I'm going to move on to your stomach and intestines. Okay. How is your appetite? Is it normal?
It's normal.
Okay.
I want like 3 meals a day.
Okay, 3 meals. Do you have any like food intolerance, so like lactose or gluten? Okay. Do you ever experience heartburn or indigestion?
I have GERD. And my dad has Barrett's esophagus related to GERD.
Okay. Do you have any pain associated with eating? Any other abdominal pain or cramping?
No.
Okay. Do you ever have like nausea or vomiting? Okay. You've had appendicitis, so you had an appendectomy.
Yes.
Have you ever vomited blood?
No, I have not.
Okay. Do you have a history of abdominal disease in your family?
Yes.
Like liver or any ulcers or gallbladder?
Not a liver, but we do have abdominal disease.
Okay.
It's very common.
Do you know what it is?
Acid reflux, GERD. Some ulcers.
And you've never had an ulcer?
Not that I'm aware of.
Okay. How is your stool? Do you guys like a usual bowel movement?
Usually 3 a day after each meal.
How would you describe it?
I would say like usually brown, like a normal brown color. Usually like soft but formed, like not too hard, not too soft.
Like soft serve ice cream?
Yes.
Have you ever had any rectal bleeding?
No.
Do you have you had any hemorrhoids or fistulas?
No.
Okay. Have you ever used an antacid or a
I
laxative?
take antacid sometimes when I have heartburn. And I've actually never taken a laxative.
That's okay. So now I'm going to move on to urinary. So, do you think you have to go like pretty frequent, or is it like just like
normal
Okay.
related to fluid intake.
Okay. How many times a day would you say you go?
5-ish.
Do you experience it like urgently, like it comes on all at once, or like it kind of like builds up?
It builds up. Like I know, like I'm
You
probably
know,
gonna have to
yeah.
pee like in the next hour.
Okay. Do you experience any nocturia? So like waking up in the middle of the night? Okay. How
I
about
usually
like
try to pee before I go to bed.
yeah, that's a good habit to have. How about any polyuria? Like, do you think you pee a lot sometimes?
Mm-mm.
Okay. Does it ever hurt to like burn?
No.
Have you noticed like a narrowed stream?
No.
Does it like dribble at the end?
No.
How would you describe your urine?
Like a yellow color, like a normal yellow.
Is it cloudy or is it okay?
It's clear.
Do you have any history of urinary disease?
Mm-mm. I've had a UTI twice. Once because of medicine, and once because of not enough fluids.
And how did you treat that?
A different antibiotic and more fluid intake.
Have you ever had a kidney stone?
No.
Have you ever had pain like in that area, like the flank, so in your back or like in your groin?
No.
Okay. So you can also use like Kegel exercises if you are worried about like ever incontinence, especially like after childbirth.
Yeah.
And just remember to like change your clothes after exercising and wipe front to back to avoid urinary tract infections. And so I am going to ask you about your genital system.
Okay.
So do you have a usual menstrual cycle?
Yes. It started when I was 12.
And when was your last cycle?
Like January 26th is when it started.
How long do you say they usually last?
5 to 7 days.
Okay. And do you notice like a lot of bleeding or like little bleeding? How would you
I
say?
used to bleed a lot, but now it's regulated with birth control.
When did you start taking birth control?
When I was 16, I got an IUD put in, and that was birth control, but my body rejected it, and so I started taking an oral birth control pill when I was 17. Which is why I was hospitalized.
Okay. Do you notice any like premenstrual pain?
Yes, very badly.
Do you take anything for that?
Usually Midol or just like a regular pain reliever, like a Tylenol or something.
Remember, you can only take up to 2,000 milligrams per day for that.
I know.
Okay. And you haven't gone through menopause. Have you noticed any vaginal itching?
Mm-mm.
Okay. Or like unusual discharge? Nope. Have you ever had a yeast infection?
No.
Okay. When was your last gynecological checkup?
January of 2018. And my last pap smear was actually in January of 2016.
Was there any like abnormal results?
No. They just wanted to figure out why my body was rejecting my birth control.
That's fair. And now I'm going to ask you about your sexual health.
Okay.
So, are you involved in a relationship that has sex? No? Okay. You are using an oral contraceptive, but not for that. Okay. And I'm gonna now ask you about your like musculoskeletal.
Okay.
So, have you have any history of arthritis or
Not
gout?
me personally, but my family. My paternal grandfather and my maternal grandmother.
Okay.
And my paternal grandmother, too.
Okay.
It's fine.
Do you have any like joint stiffness or swelling or pain?
No.
Okay. Any limitation in motion for whatever
I
reason?
wouldn't say so.
Do you have any noise with your joints, like if
Yes.
you walk?
I can't crack my ankles very easily. And sometimes my knees.
Do you have any pain or cramps, weakness in your muscles with activity? No.
No.
Do you have any back pain?
No.
Have you ever had back pain before?
I don't think so.
Do you have any stiffness?
Mm-mm.
How much walking do you think you do per day?
Like 10,000 steps, whatever that equates to. Like usually 8,000 to 12,000 steps per day, depending on the day, depending on what time I wake up.
Yeah. Do you have any like effective? You don't have any effective limited range, and you don't use any like walkers or canes.
No.
Okay. So now I'm going to ask you about your neurological system.
Okay.
Do you have a history of seizure disorders?
No.
Have you ever had a stroke?
No.
Have you ever fainted?
No.
Have you ever blacked out? In your motor function, have you ever like noticed a weakness?
Not that I can think of.
Do you have a tic?
No.
Do you have thyroid disease?
No.
Never mind. That's okay. Do you have any coordination problems?
No. I'm clumsy, but I've always been clumsy since the day I was born.
That's okay. Most of us are. Do you have any like issues with sensory, like any numbness or tingling? Are you sensitive to like the hot or the cold to touch?
No.
Okay. Do you have any like nervousness?
Yes.
Yeah.
Related to stress and anxiety.
Okay. Have you noticed any like mood changes?
Not really. It's regulated by my medicine.
Okay. Any history of depression or anxiety?
Yes. Both.
Do you have any history of mental health dysfunction or hallucinations?
No.
Okay. So now I'm going to ask you about your blood. Do you have any like bleeding tendencies? Like, do you bleed a lot, or have you noticed anything weird?
No.
Do you have excessive bruising?
Yes.
Okay.
I bruise very easily.
Have you noticed any like of your lymph nodes swelling?
Mm-mm.
Any exposures to toxic agents or radiation that could affect it? No. Have you ever had a blood transfusion?
No, I have not.
Okay. So now I'm going to ask you about your endocrine system.
Okay.
So do you have a history of diabetes or diabetic symptoms?
No. We have a family
Family
history of
history,
diabetes, but not me personally. Just both of my grandmas. Nobody else.
Do you have a history of thyroid disease?
No.
Do you have an intolerance to the heat or the cold?
No.
Have you noticed any like different change in your skin,
Mm-mm.
pigmentation or texture? Do you have excessive sweating?
No.
How is your relationship between like your appetite and your weight? Do you think you like it should be normal?
Yeah.
Do you have any abnormal hair distribution?
No.
Is there a need for hormone therapy?
No.
Okay. All right. So now I'm gonna ask you some questions about like your activities of daily living.
Okay.
So, when was the last grade? What was the last grade you completed?
My freshman year of college. I'm studying to be a nurse.
Good choice. How do you like that?
It's pretty good. It's stressful sometimes, but it's good.
Yeah. Keep pushing through.
It'll be worth it in the end.
Yeah. Okay. Any other like significant training for anything?
Not really.
Yeah. How is your financial status?
I would say fine. I'm independent. My parents still claim me on their taxes, so.
That's okay. You're in college. Okay. So do you think, like, it's adequate for your lifestyle and health concerns? Like, they take care of you if you
Oh,
get sick?
yeah. My mom's pretty fantastic. So.
What is your, like, belief system? Do you have any, like, religious practices?
Christianity.
And how would you describe yourself?
Outgoing, responsible, honest, and brave.
Those are all very good. Do you have any, like, self-care behaviors for that? Like, anything you do to, like...
I love bath bombs and pedicures and shopping and face masks and coloring.
What girls don't like that stuff? So, do you have, like, any exercise? Like, what's your usual pattern of a day?
Like a normal day, kind of exercise, walking to and from classes, maybe working out sometimes when I get the opportunity to.
You, like, take the stairs when you can.
Sometimes the elevator is super tempting, but, you know.
Yeah. Sometimes you just don't feel up to the stairs. Do you need any assistance, like, with feeding or bathing?
No.
Toileting? No.
Nope.
You're pretty dependent.
Or
independent. Like,
I'm independent on myself.
Um,
Don't need anybody else but me.
What do you do for fun? Like, what are your leisure activities?
I love to sing. I love to play piano and listen to music, travel. Love to travel. And I love to shop. There we find out why I'm a poor college student.
Okay. How, like, what would you say your exercise pattern is? So, like, how much do you get per day or per week? Just, like
a normal amount. I would say I try to work out, like, once a week. Like, hardcore workout once a week.
Yeah.
I love fitness martial. That is really fun. I can't dance, so I do it by myself in my room, but it's a fun time.
It's okay. At least you're doing it. So, do you have any other, like, self-care behaviors related to, like, exercise or?
I would say so.
No. Okay. What are your sleeping patterns?
I try to get, like, 8 hours a night. It's usually closer to 7.
It's pretty good for a college student.
Yeah, I like my sleep quite a bit.
Do you take any naps? Daytime naps?
I wish.
Do you use any sleep aids at night?
I use melatonin rarely, but I use it when I move back to school for the year or when I move back home.
Yeah, when there's, like, a change.
Mm-hmm. My dog likes to keep me up, so.
We'll get him some next time.
I'll slip him some melatonin. No, just kidding. I wouldn't actually
Maybe some Benadryl.
Maybe. No.
Do you have any other self-care behaviors that's, like, related to, like, the sleep?
I don't know. I like to burn a candle when I'm sleeping. I probably shouldn't say that out loud.
No, that is. Maybe we can, like, try something.
Well, okay, I don't burn the candle. I do, like, the heat, the little warmer. I leave my candle
wax
warmer.
melting.
Yeah. At home, my mom burns candles, and she blows it out before she goes to bed.
Okay.
So there's no risk of burning anything down.
Maybe we should get you, like, into, like, a wall plug-in or something.
That's what my candle warmer is. It's like one of the ones that goes on the wall. Yeah. I probably should think about that when because I'm not actually burning a candle, but it's close enough. It smells like it.
Okay, so what have you eaten in the last, like, 24 hours? Like, what have you eaten today?
For breakfast, I had one of those sweet and salty nut bars, and coffee. Here's where we're going to learn how much I'm addicted to coffee. For lunch, I had a gyro or gyro and some peas and some yogurt and more coffee. And for dinner, I haven't eaten it yet, but I'm probably going to have some soup. Because that sounds pretty good. Actually, let's say SpaghettiOs, because I think that's what I actually have in my room.
Is this like a menu typical?
Yes. Mine is the dinner. I don't always eat SpaghettiOs for dinner, but it's real tempting today.
Very good. It's okay.
Hey, it has the meatballs in it too, so it'll have some protein.
Who buys the food?
Me or my mom.
And who prepares it?
Me or my mom, or the school.
Are your finances adequate for food?
Yes.
Who is present at meal times?
Me, my friends, and sometimes my family if I'm home.
Do you have any other self-care behaviors related?
I like to cook and bake a lot. I don't have time to do that necessarily while I'm at school, but during the summer I definitely love to do that.
Yeah, that's great. How would you describe your role in your family?
I'm the daughter. I'm like the second mom.
How do you get along with your family? How would you describe that?
I get along well with them.
And your friends, co-workers, classmates, pretty much. Yeah.
Pretty easy to get along with, I would say. Try to be at least.
If you have a problem, who would you go to support with?
My friends and my mom. Definitely my mom and my grandma. My paternal grandma. My mom's usually the first person I call. Depending on the situation. Sometimes I call my dad, but it's usually my mom.
Yeah.
If I'm in a car accident, it's my dad.
What do I do?
Because he's totaled like 3 cars, so in 1 year, he totaled 3 cars, so.
At least he's okay.
Yeah. 16-year-olds shouldn't drive Mustangs, but that's besides the point.
How much time do you spend alone a day?
Like 5-6 hours, and then while I'm sleeping, because I live by myself.
Okay. So you live by yourself. Is it pleasurable or isolating?
I like to be alone sometimes.
Sometimes you just need it. Do you have any other self-care behaviors related to?
I call my mom
stuff?
once a day. Sometimes more, but usually just once.
What would be your stresses in life right now?
School and my job. And what I'm gonna do for the summer. I teach preschool and I work in the admissions office. And I'm a nursing student.
So, have there been any big changes in the past year?
I moved. I changed my friends around a lot. Lots of people have died.
How have you coped with that?
Okay.
Would you say it's a normal coping?
Yeah.
Do you have a lot of support?
Yeah.
What are your methods that you do to relieve some stress?
I take a shower. I talk to my mom. And I like to color or paint my nails or something.
Are these methods helpful?
Yeah, usually.
So, how would you describe your daily intake of caffeine?
It's probably higher than it should be. And it's usually coffee. I don't drink any pop. Tea is okay, but I usually drink my sleepy time tea instead. It's actually what it's called. It's lavender and chamomile. It's amazing.
Sounds good. Have you ever smoked cigarettes?
No.
Have you ever drank alcohol?
No.
Have you ever had a drinking problem?
No.
Have you ever used street drugs?
No.
Marijuana?
Nope.
Cocaine?
No.
Barbiturates?
No.
Heroin?
No.
Cocaine?
No.
Amphetamines?
No.
LSD?
No.
Any others we should know about?
Nope.
Have you ever been in treatment for drugs or alcohol?
Nope.
Okay. So what kind of structure or like house do you live in? Like the most, so like 9
I live in a dormitory like 9 months out of the year, and then I live in a log house the other 3.
Do you have neighbors
Yes.
in both places?
Yes.
And you live alone at home or at the dorm?
Mm-hmm.
And
And then
then
with my nuclear family in the log house.
nuclear?
That's what they're called. We are mom when you have a mom and dad and 2 kids. You learned something new today from me.
I did. Do you feel safe at home
Yes.
and in your community?
Yeah.
Do you have adequate heat and utilities?
Yes.
Do you have access to transportation?
Yes, I have a car.
Have you ever been in a car accident?
3. 4 actually. One's with my parents. The one was the day before my first day of first grade. My second car accident, I hit a mailbox. It just knocked my mirror off my mom's van. My third car accident, I totaled my mom's van. I rear-ended somebody. And my fourth one, I ran a red light on accident. And the lady turned as I was doing it.
Well, I'm glad you're okay.
Everybody's always been okay.
Are you involved in community service?
Yes, I volunteer at a lot of places.
Do you have any hazards at home or the workplace you're concerned?
No.
Do you use seatbelts?
Yes.
Have you traveled to or ever lived in another country?
No.
Have you ever had a military service in other countries? What are some self-care behaviors related to this?
I've become a much more cautious driver.
It's a good one.
I never drive when I'm tired.
Good.
That's how all the accidents have started.
Do you feel safe at home, like with your partner?
I don't have a partner. But if I didn't feel safe, I would leave.
Yeah, that's good to know. Have you ever been emotionally or physically abused by a partner or someone important to you?
No.
Have you ever been hit, slapped, kicked, pushed, or shoved by a
No.
partner? Has a partner ever forced you into having sex?
Nope.
Are you afraid of your partner or an ex-partner? Please, this is about your occupational, so your job. So please describe your job.
An office job or a teaching job. I'm on my feet a lot.
Do you have any health hazards at work? So asbestos or chemicals?
No. Sick kids.
Is there any equipment at work designed to reduce the exposure?
I mean, they get sent to quarantine, basically.
Is there any work programs designed to monitor your exposure? Any health problems related to the job? You just children being sick, you might get sick.
Yeah, like some colds and stuff.
What do you like or dislike about your job?
My office job, I like a lot of the people I work with, but I dislike some of the people. And my daycare job, I like working with kids, but I can't stand most of the parents.
Okay. How do you define your own health? What's your health definition of health?
Like emotionally and physically healthy. Finding that balance between those two things, I think.
How do you view your own health now?
Pretty well. I think I'm finding that balance and learning where my life fits with that.
Do you have any concerns?
Not really.
What do you expect will happen to health in your future?
I hope that it will continue to be good, maybe even get better.
Do you have any health goals?
Reduce anxiety, maybe lose a little weight, and monitor my PCOS.
And what are your expectations of the nurses and physicians in this office?
Just to be caring and understanding and knowledgeable. I don't want somebody that is dumb.
Yeah, no, that's good. I think you covered it right. Well, it was nice meeting you, Hannah.
Nice to meet you too.
Have a great day.
You too.
Thanks.